We just received some funding from Google.org, which has been an amazing boost to the system. It's allowed us to expand our team and really think about new approaches for disease surveillance. One thing we're moving into is the area of social networking. So thinking, for instance, Facebook for disease, where we bring together the community of public health professionals together to discuss and curate information that, say, comes in from the news media. So we're not just creating a one-way flow of information to the users, but allowing users to interact with the data and allow for public health officials to communicate and think about outbreaks and whether, in fact, the news media is accurately reporting on an outbreak, exchange information, exchange ideas. So the idea of potentially like a Wikipedia for infectious diseases where everybody can communicate, where it's essentially a collaborative filtering approach as opposed to a centralized approach where we're feeding everyone information. And we have ideas, for instance, like the eBay style of rating of a potential disease reporter. And if someone reports on something properly and is accurate, then they would get a higher rating and we'd have greater confidence that their reporting is proper. And it's the exact same way as on eBay, where if someone, for instance, sells a good that is defective or doesn't pay on time, they would get a negative rating, and we would trust that report less. We're really trying to engage the community of both the public health as well as just the general population, those just interested in public health. And the idea is to engage them not just from the purpose of commenting on data, but also reporting. So everyone can be a reporter looking for data across the web. Our system mines about 20,000 websites every hour, but there are many other websites that are out there that we're not tracking. And so the idea is that we can put public health surveillance into the hand of the individual, and they can contribute information, and that can also get commented on. And really the idea is we're trying to develop a platform to integrate as much surveillance data as we can, and we're in talks with organizations like the CDC and WHO about developing a common platform for global public health. And if we can bring people in, the human network component into the data, that's when really we'll see some incredible value from our system that we've developed. And the way to do that is through technology like social networking, where there's an ease of interacting with the information and commenting and really allowing people to vet data that comes into the system. One of the major questions that we have is around infectious disease dynamics and the impact of different control strategies. And I think that's really an area we're still pushing forward on. And for instance, we're looking at the impact of new vaccination strategies that target children around influenza. And that's been a major research goal of ours, is to understand the population impact of, say, vaccinating children against influenza, and whether that leads to a population level shift in the amount of mortality and morbidity we see in flu, for instance, in the elderly population. Because if you vaccinate the younger children, you're potentially reducing the vectors of transmission in the population. And so we have a grant from the NIH to really study this association, and there's been recent recommendations, for instance, for all children to get flu vaccine in the coming flu season. So we're going to be actively tracking that to see whether, in fact, we're seeing a population-wide reduction in influenza by targeting these children. And I think that's a fairly exciting topic, because we're really thinking about the population-level impact of a public health strategy. And I think that sort of gets to sort of the overall goal of our research, is really looking at population-level effects of different strategies, whether it's vaccination or quarantine or reducing travel patterns, social distancing. So we're looking at all these different types of measures in, say, an epidemic flu or a pandemic or the next SARS, for instance, to really understand what the appropriate control strategies need to be.
One area that I'm just actually have two grants to begin to study now is sort of biosurveillance in reverse. How can we take those data and actually inform clinical decisions with them? So, for example, if you're trying to decide whether a child has pertussis, it would be extremely helpful to know whether there's a pertussis outbreak in your area at that time. None of the clinical decision rules or approaches to medical decision making in any kind of quantitative way incorporate information about what's going on at the population level in your region at the time. So this is something that I call contextualized medicine, the ability to make a decision about your patient in the context of what's going on at the population level. So it's kind of biosurveillance in reverse, because we're now bouncing the data back off the public health scale and bringing it back to the individual clinical scale.